You guys are doing a great thing. It's such an uncomfortable topic to talk about, especially for a guy, young guys in their early 20s. And, I'm glad that, I could tune in and, listen to you guys.
Spencer Kobren's The Bald Truth.
I like doing that to you, making you a little nervous before the program. Just keep the camera on you. You're like, holy shit, where is he? Do I have to start the show?
I ain't nervous. It's all good.
What's happening, people? Guys, welcome. And ladies, welcome to the broadcast. Phone number is 888-659-3727. Joseph, just to start the show off, I was laughing because I'm rushing to get the sculpture together, which was insane today. But, I got back and I'm like, oh, shit, I could just wear a hat or, I'll shower. Let me shower, put the sculpture together. I do this once a week. What's the big fucking deal? So I'm trying to...
You shower once a week?
Yeah. So I'm going to file that away. So I'm rushing. I have to laugh to myself. I just remember, you remember my place out in Calabasas. I just remember, and you probably don't know that. Maybe you do know this if you remember this, but essentially back in the day, you didn't have like one gigabyte internet.
No, of course I remember that.
Yeah, and the most was maybe if you got 20, I guess, what is it, MPS? what is it called?
Yeah, megabits per second. Yeah, if you got 20.
Up, you were like, okay, you're gold. But you still had to do Ethernet. So I had these 200-foot orange cords, I don't know if you remember that I plugged into the Ethernet upstairs. And this was a pretty big house. It was like almost 6,000 square feet.
Yeah.
I ran it downstairs. I dropped downstairs. The dog would go nuts. And then I'd run it into my studio.
Yeah. On the baseboard?
Yeah. And I didn't know. I didn't on the baseboard. It was just loose, just for the show. Yeah. And then I would plug one into my Vonage devices and one into the internet. And I was just thinking, I've been doing this for so effing long. It's hilarious. It's basically like some guy in his underwear, half the time with a hangover, doing his own thing with his own like ancient board, and the equipment's pretty good. The camera's new, and but the fact that we've been able to essentially do it to this level for so long when it was black magic, it's hilarious to me. And also just the rushing to get ready. Yeah. The whole thing just makes me laugh. Now everybody else is trying to do like diary of a CEO type of podcast and all this stuff with these, fancy studios and all that. And I think, listen, there's a place for it. But I see what's interesting is I'm seeing the pendulum swing back where some of the guys who did really well in podcasting are kind of, I don't want to say dumbing it down, but they're doing more remote stuff. They're doing more stuff from like a little smaller type of, like a studio. It's interesting, like the pendulum is starting to swing back now. So who knows? Maybe if I actually take this to my own page and we promote your thing, this 20-year-old setup are still going to work.
You know what? It's like this. People are realizing after putting in all this effort for promotion and production, like the production is what I meant to say, putting it all into this production of, trying to be a certain level. Like a lot of these podcasts, like Diary of a CEO, it looks like something you'd see on ABC 20 years ago with Barbara Walters.
Yeah.
Like the lighting is just right, the angles.
Well, he has several studios.
The lens. Yeah.
UK, Los Angeles, New York, and they all basically all look the same. And this is a much different animal.
Of course. But it could be just as effective if it was just running in someone's basement. Made up. But with a background or like what you're doing, and save so much money. Like you don't need that. That's the beauty of all this. I hate to say the cliche, but that's the beauty of the internet.
Yeah. Well, I don't even know
because it is.
I don't know if you need it or not because this podcast, whatever this is live stream. It's always kind of stayed. Let's just say it's been a boutique situation since you've been doing it online, but. It's going to be interesting, depending on where I decide to take things. Will this still hold up? And the thing about my studio, is, and we're going off on a tangent here, guys, we'll take your calls in a second, so hold on, is that the room is so big, I can make it look like anything I want.
Oh yeah.
You know, and I
Same
already
here.
have the equipment. And honestly, when I have somebody in the studio, I can make it look clean and sharp. And if I chose not to run my own board, I could just sit in a chair, do whatever it is. I could have really great lighting, you know, and change the backdrop. There's a lot of different options. But there's something that I really like when we rush into the studio and we're late and it's just us and there's no fucking makeup or no bullshit. And it is what it is. We're taking live calls. I don't know. I mean, as I was rushing today trying to put this sculpture together, which, you know, kind of worked, I was laughing to myself. I'm like, I've been doing this shit for 20 years.
Mm-hmm.
Last minute, trying to get it together. We don't really prepare for the show, which some people in the chat room are going to be like, yeah, we know. But, you know, we just do it. There's no pretense to it. And that's
I put
what I
some
think is
thought
fun.
into it only because I got to come up with a subject for the thumbnail other than just two guys. Call us, you know, other than that. Like I got to come up with something for, you know, subject matter for people to say, okay, they're going to talk about this if there's time. But like I was on a ferry coming over from Vancouver Island an hour ago.
Finally coming out. You were finally coming out. Thank God. After all these years, you're finally coming out.
You did that off camera and you're such a 12-year-old, you got to keep doing it on camera. It's like, for fuck's sake.
Yeah, but you phrased it so much more. It was just really, it was like a layup for me.
But the thing is, and I got to say, I'm pretty surprised by this. I haven't touched my hair, and I was out, like the wind of the ocean was going through my hair. I just did this.
Yeah, you don't do it. You don't do as
are.
much of a con job as I do. I mean, you comb it back. I comb it to the side. I really try to cover as much as possible. I try to make it look as thick as possible, which I have to say, maybe it's becoming ridiculous. I don't know. Maybe I'll just shave it off. We'll see. Guys, the phone number. Go ahead.
A person wants to see the Kane from Kung Fu look, but that's just me.
Look, if my tendon rehab continues to go as it is, I may just get really jacked in 6 months. Say, screw you all, you guys get like a neck tattoo.
Mm-hmm.
Just shave.
There you go.
Guys, the phone number is 888-659-3727. We are live. I'm in Los Angeles still, which is nuts. Joe Tillman is live in Vancouver, British Columbia. And I'll say one thing, and we'll take your calls right now. The only reason I'm still in Los Angeles is because I can afford to live in Los Angeles in a way where I feel relatively safe.
Yeah.
But I would say that this place, I'm sorry to say this, I love California. I'm a 25-year Angelino at this point. It is a hellscape.
Dystopian hellscape.
You can't even go to a drugstore or like a CVS. Everything's locked up. I don't care if you are, well, they actually closed the CVS in Beverly Hills. So you go to Westwood or whatever close by. People just waiting outside. You don't know what the hell's going to happen. It's nuts, man. And we're talking about expensive areas. And I'm not saying it should happen anyplace else. But it's unusual, or used to be unusual, to see this type of stuff in areas where people have $2 or $3 million homes.
Yeah.
That's why you try to make money, to escape this shit. All right, guys.
People used to try to get into LA.
Oh,
now they want to get out.
When I moved here 25 years ago after 9/11, it was paradise. Coming from New York City, paradise. I couldn't even believe. I'm like, how do people live this way?
This is real?
It was. Yeah, I had to pinch myself. I couldn't believe it. All right, guys. Phone number 888-659-3727. We are live. We're here to take your calls. Let's get to the phones. Hey, you're on the air. Who's this and where are you calling from?
Hey guys, it's Seb from England.
Holy shit, Seb! How'd you get in for the
3 weeks
first
in a
caller?
row.
Would you call right as soon as we pop the camera on?
I think so. Yeah,
I'm glad
I've got
you
to get in
did.
the queue, man. I got to get in.
What's happening, brother? What's going on?
I'm good, guys.
How's
How
your
are
week?
you doing? Oh, it's been steady. Still taking the medication. I'm approaching that 6-month mark, and everything seems to be coming together. It's really starting to kick in. So that's really, really good. But yeah, overall, just been taking it easy. Trying not to think too much about it, just let it do its thing, because you can sort of zone in and sort of count the hairs. Oh, there's a new one there, and sort of it gets a bit obsessive. So try to ignore it a little bit. But no, overall good. And how about you guys? How are you doing?
You know, I was just trying to be nice. I didn't need the whole story of your life.
Oh, there's more. There's more.
Oh, great. I just want to hear about your buddy. I just want to hear about that.
Oh God, no, still nothing. He saw the progress photos, and he just read them, and that's it. Just no comment, nothing. So yeah.
Oh.
Yeah, he's I think he's angry. But no, I thought I'd call in and see how you guys are doing, and also tell you that I had 2 stories last week, and one of them we gave you one, but there's one left.
Yeah, let's hear the new one.
All right, let's do it.
There's a few, but this is so. We talked about the despair of me finding out, I was balding and sort of coming to terms with it. We talked about the fear of finasteride that I had, that I ultimately made my friend go bald.
Yeah.
And we talked about, the sort of the guilt of that as well. So today we're talking about, I guess, stupidity or something stupid, really, on my part. No other way to word it. So I've got a very good friend of mine. He's, as far as I can tell, he's completely unaffected by male pattern balding, androgenic alopecia. He is not touched by the androgen sensitivity, nothing at all. Okay, he's like a Norwood 0. I don't even know if is it a 1 or a 0. He's not balding at all.
So you didn't tell him that water causes cancer and he stopped drinking water?
No.
Okay. All right, just making sure.
So yeah. So no. So this guy. So we're going back now about 6 years ago. So it'll be about 2020, and I'm thinking, I'm starting to show that I'm balding. I'm struggling to hide it, and I talk to him about. I say, I'm doing this, I'm doing that, I'm trying to cover it, and he says, oh, it doesn't look that bad. Don't worry about it. Typical response from someone who's not.
Just be confident, dude. Don't worry. It's just hair.
Yeah, exactly. Yeah. He says, to this day, famously, he'll say,
I'll shave my
head.
If
I start going bald, I'll shave it off.
Yeah.
I'm like, mate, you've got a perfect head of hair. You don't even understand what. Anyway, so he says to me one day, he says, I don't use shampoo. And I said, what? He says, yeah, no. He says, it's a waste of money. It's a waste of time. He says, the oils come out on your hair and it makes it healthier. And he says that I don't use shampoo at all. And I'm thinking to myself, this is before I looked into I really looked into the genetic aspect of this. And I was clutching at anything I could find that would potentially help. And he says, yeah, do not use shampoo because it'll thin out your hair. It'll get brittle, fall out, all this stuff. So what did I do? I went for an entire year without using shampoo.
No, you didn't.
Thinking it would help.
You went
okay.
So there's this whole thing online, this like no shampoo like mantra, and it's really it's pretty insane actually. Especially if you know this, you've learned this already probably through the show. But if you're dealing with androgenic alopecia, you're actually exacerbating the hair loss because more DHT is able to bind to the actual manufacturing process, the hair follicle, because you have a sebum buildup. And the more sebum around the hair follicles, the more active the DHT is going to be in that particular area. And if you're sensitive to DHT, which you are, you're going to bald faster. Let's not even mention the possibility of seborrheic dermatitis and and other issues, inflammation issues.
So in that year, my balding accelerated. Compounding the fact that I'm in my sort of early 20s, I'm going to the gym, I'm doing basically the worst things possible for I mean, look, it's good to exercise, and no one's disputing that, but raising my testosterone, I'm going to the gym, I'm not using shampoo, I'm using water only. And I tell you now, in that year, my hair loss accelerated. Immediately, I started itching. I didn't know what seborrheic dermatitis was, but my head started itching, mainly in the center, and I was itching, and it went away and it came back. And by the end of that year, by the sort of the 10-month mark, I was peeling like a snake. Like there were flakes and chunks of I can't even just like snake skin was coming off my head, and it was getting to a point where I put the minoxidil on and it would burn because there were open wounds on my head. And I'm thinking, oh my God, and by the 11th or 12th month, I said, you know what, screw this. I'm using shampoo. I got some Head and Shoulders or some off-brand anti-dandruff, whatever shampoo. And within a week, the itching subsided, the flaking went down, and it just stopped. And I said, you know what? I am never, ever doing this no poo, no shampoo.
Just imagine if, and obviously you don't have a lot, you have hair follicles all over your body, but imagine if you had a super hairy chest and you didn't use any cleansers, any type of shampoo or any type of soaps or anything, I mean, at the very least, if you want to go as natural as possible, you need to clean the oils and the sebum and the buildup off your entire body. And the thing about the scalp is, I mean, no one thinks about it. They think it's just your hair. The hair on your head is dead. That is dead keratin. Nothing, and also these shampoos they're not penetrating your stratum corneum. So, if you shampoo your hair too often with shampoos that don't work well with your hair, you can create some drying, some split ends, but you are not causing anything as far as exacerbating androgenic alopecia. That's all happening underneath. And because you're allowing that sebum to build up, you're allowing more shit to happen underneath. And these kids they talk about how homeless people never lose their hair, which is bullshit to begin with. It's insane, really. And you fell for it, like every other idiot out there.
Yeah. No, it was stupid. It was really.
Seb, you're not an idiot. It's a radio show.
That time in my life and that moment, that sort of decision I made, and that period of my life, I was stupid. That was really silly and short-sighted. And I believe to this day, he does not use shampoo, and he has a perfect head of hair. We're both 30 years old. And
you ever smell his scalp? He probably stinks.
He has a scent about him.
Does he really?
But yeah, so no, I just thought I'd share that. If anyone's thinking, oh, I'm going to no shampoo, I'm going to shed less, I'm going to do that. Honestly, it was unbelievable. It was just like a disease on my head. It was, and looking back, it was severe seborrheic dermatitis. I'm lucky it didn't progress into like a folliculitis, or maybe it was on the verge of that. But I just caught it. I said, you know what, I can't do this anymore. And I had to stop. So I just thought I'd share that. If anyone's thinking about doing it, maybe think again. That's all I can say.
Oh no, I appreciate that. And that's an anecdote that's really important. So many people still to this day, listen, I have to tell you, the one thing I learned about once I really started to do more on social media, sadly, is just the level of low IQ people out there in the world. It's effing insane. I just can't even believe some of the stuff that I see in my feed. Forget about the stuff that you see every day. There's just people asking me questions or trying to fight me on certain things. I'm just like, I can't help these people. There's nothing you can do with them. So the bottom line is, you're right. Anybody who's young out there who's considering all this hocus pocus that you see online, like not washing your hair, that is one of the worst things anybody with androgenetic alopecia can do for themselves.
Yeah. And my skin is very oily, and I've had really bad acne from a very young age, from about 12 years old, 13 years old. And I think that there is a correlation. There's been discussions about, acne
For sure.
and sebum and androgenetic alopecia. It always seems to be linked in some way. But one interesting thing, just a bit of a silver lining to all of this, I mentioned last week I am using Dutasteride, which is it may have an effect on the androgen receptors in the skin, and apparently it may potentially reduce sebum a little bit.
That's what we've heard.
What I've noticed is the skin on my face has slowly but surely cleared up.
Some people notice that their pores get a little smaller as well.
Mm-hmm.
Yeah, on the nose as well, in particular. But one thing I will say is in the first maybe 2 to 3 weeks, I had a massive breakout. So within 3 weeks of taking Dutasteride, I don't know what it was, but my whole face, it just went absolutely crazy. And I was on holiday at the time, which was brilliant.
Right.
But my whole face just filled up with spots. I thought, oh my God. And I carried on taking it. I thought, this must settle down. And now I don't have any spots at all. It's really, really good. And so the sort of the oiliness has subsided, which is a nice little side effect. So
look, anytime you change your hormonal balance in any way, I mean, it happens with birth control pills in women as well, and it takes them time to settle. I mean, all of these potential, at least short-term side effects can happen. But yeah, I mean, what you said is exactly correct. It's not something that I talk about a lot or that I promote, and I would never say, hey, if you have issues with your skin and your hair, jump on Dutasteride. I mean, you have to see your doctor, but at least anecdotally, and honestly, even in the hallways of meetings, you hear docs talking about this stuff. There seems to be, not only does there seem to be a correlation, it seems that even 5-alpha reductase, even blocking 5-alpha reductase type 2 only, might have some impact on improving people's skin. So, and that's just with finasteride. So we just don't know. No one's doing any real studies.
No, but there you go. I just thought I'd share that with the class.
Well, Seb, you're great, man. I mean, the story wasn't quite as funny as usual, but I appreciate it.
We still love you. We still love you.
It's still pretty entertaining.
Look, there's more, but I'm saving them.
All right, good.
There's a pretty good one, but
yeah,
but yeah, okay.
But otherwise, you're doing well, right?
Yeah, I'm 5.5 months. I'll be approaching the 6-month mark, and the last thing I will say today is my hair. It feels different. It feels like Velcro. It's thicker, and it doesn't feel like my head, especially the back and the sides and a bit around the crown and the top. It doesn't feel like my own hair. It's thick. It's like it feels. I can't even explain it. Like a fake, like a rug or something, like someone's like nylon. It's really strange.
Seb's going to come on camera at some point. He's going to be wearing a rug.
Just
100%. A system.
All right, brother. Listen, we appreciate the call. Call us next week. I mean, listen, you never know. I mean, I'm 61. I could drop dead tomorrow. But if I'm here, I would love to hear from you.
Great. Will do.
All right, brother.
And I hope you are here.
Okay, me too.
Cheers, guys.
All right.
I'll be watching.
Cheers.
Thank you.
See you, Med.
Cheers,
See you, Seb.
Phone number is 888-659-3727. There is this
I want to have a beer with that guy.
Yeah, there's this whole no shampoo or no poo, whatever they're calling it online.
No
it's
poo.
Absolutely insane. And you know what's interesting? I've heard some dermatologists tell patients to, at least online, that they could wash their hair less, and that may benefit them. That is really not good advice.
Well, here's why. Okay, and I remember this became a thing maybe 10 years ago, maybe 15 years ago. But I remember seeing online people talking about taking the no wash challenge or however they were framing it for a month. And I remember reading an article in some publication, like a legitimate publication, where the author was talking about the stages of what their hair went through when they didn't wash their hair for a solid month. And like the first week it was really oily and it was just terrible. And then the second week it was really, really oily and terrible. And then the third week it started to actually be less oily and terrible. And by the fourth week, it was like normal hair. They could style it and everything. It didn't feel heavy, didn't feel oily. And so from that mindset arose this idea that washing too much was bad for you. And it was stripping away all the oils that our scalp needs or our hair needs. And after time, it balances itself out. Because 100 years ago, no one was washing their hair with shampoo every day, which is true. But that's where a lot of this comes from.
Well, I can tell you what is actually happening. So you're producing a lot of sebum initially, and you produce so much sebum that essentially the pores become quasi-clogged. So it's like a little bit of a solid, almost like a biofilm of sebum.
I like that biofilm.
That stops coating the hair like it did normally. So as you continue just to use water, especially chlorinated water that we have in our municipal, water systems, you start to strip the hair of that oil because while you're still producing oil, it's kind of getting clogged. It's not coating the hair shaft like it was before.
Yeah.
So that's what they're seeing. And again, I'm not a doctor, so if there's any doctors out there that want to potentially say that I'm incorrect, I guess it's possible, but it's unlikely. Because according to the Washington Post, at least in 1998, I have an encyclopedic knowledge of androgenetic alopecia and the way hair growth and hair loss. I think that's the quote.
That's a good quote to have. I like that.
No one gives a shit about those old quotes anymore. I mean, I still have it on the website because we haven't updated the Bald Truth website since the Civil War. I also have a quote from the Pittsburgh, is it Pittsburgh Tribune? That's the big paper in Pittsburgh. It basically said, I have a dedicated audience that would have Rush Limbaugh pulling his hair out. Now, back in 2002, that was a big deal to get that. Now no one even knows what that means. They don't even know who Rush Limbaugh is.
He's only been dead for 5 years?
Yeah. For crying out loud.
That's good.
I had a real career at one point, Joseph.
I recognize that.
God.
You did good. You did
it.
good there. Good job, trooper.
I'm some guy with a hairsprayed comb over it. Let's see who this is. Hey, you're on the air. Who's this and where are you calling from?
Hey, it's Zach from Florida.
Hey, Zach.
It's the Pittsburgh
What's up, Zach?
Post-Gazette.
Pittsburgh Post-Gazette. That's right.
There you go.
Yes, sir. Hey, I spoke with you all a couple weeks ago. My situation, I'm on topical finasteride and minoxidil, and I'm trying to transition into oral just to, I guess, for ease of use and also just to maybe potentially get a better result. I don't think it's what I'm doing now is not working per se, but maybe I can do better. Oral was the thought, and it would be a little easier.
So did you start the topical because your physician recommended it, or was it because out of fear of getting on oral medication?
I'm not scared of it, but I had to I did take the oral minoxidil, and it gave me heart palpitations right away when I took it. So I got that, and then they said, well, you got to use the topical still. So my thought was, if I have to use that topically, I might as well just do everything all in one.
I understand.
Was the thought. So
that's not illogical. That's a logical viewpoint. Yeah. I get it.
Right. So I started, and I'm not afraid to take finasteride or anything like that. I'm dumping a gallon of shit on my head already. So I did do what Joe said, and I took an eighth of a Proscar, and I took it the first time, and it made me super tired, almost couldn't even move type of thing, so tired, absolutely zonked.
See, if you didn't follow my instructions and you took the whole tablet, you'd be in a coma right now.
Yeah, you'd be dead.
I'd be dead, right?
Yeah.
Right.
Tillman comes through again.
Whatever. I know, he killed another one. So I took that. I waited. I was going to do it every other day. I waited 2 days, took another, felt almost like the feeling was almost like I went drinking, and it was like the hangover was wearing off and I was coming back to it. I took another eighth of it again the next day, and it was the same thing. So I'm like, damn, all right. And like I said, I'm not like manifesting side effects or anything like that. I'm not afraid to take it. That's just what happened. So I waited. I took it again. It was like a week later, took another little chip of it, felt fine, went to sleep, woke up, and it was like, I always wake up on cue at 6 a.m. I woke up, it was like 9:30. It zonked me again.
Really?
Is that something?
Are you sure that
is that something?
Are you sure it wasn't Ambien accidentally?
No,
Yeah, exactly.
No, it's a Proscar. I got the good one, the Proscar. It's everything, I went with the advice, and like I said, I'm not afraid to take it or anything like that. That's just what's happening. And I didn't know if that's something that maybe, does that stop potentially? Should I
don't know. It's very possible why I've been feeling like shit for 30 years. I don't know, really.
I've never heard of that.
Listen, anything is, when it comes to medication, anything is possible. Everyone, our biology is, while it seems the same, and they do clinical trials and, they test thousands of people. If you put it out there in the wild and you're treating hundreds of thousands of people, there are going to be adverse effects that didn't come up in the clinical trials, and that actually may not happen to enough people to be reported once the drug is on, in the market.
Mm-hmm. Yeah,
you could have some, side effect that maybe only affects like 0.0001% of the finasteride population. Who knows? Or
does it make sense that I've never gotten anything with the topical of it, like no side effect at all, and then went to that, and it's like boom right away?
Not as far as the drug is concerned, but it's possible that the binders and the fillers or the coloring in the Proscar tablet itself may be giving some adverse effects. You're a type person who you didn't have any adverse sexual side effects, right?
No.
So, I mean, you might want to find a good generic and give that a try. Talk to your doctor about that. I mean, listen, I started on brand. Obviously, that's the only drug that's really been tested. All the generics are essentially, it's almost like getting a 510K clearance for a medical device.
Ooh, good. Good analogy. I like that.
There's a predicate device. And in drugs, that's the drug that was tested by the pharmaceutical company. When that patent is gone, then everyone essentially, if they develop a bioequivalency of that drug, then the FDA approves it. So that's why I go for brand. But in your case, it's very possible that for some reason your body doesn't react well to brand name and may react better to a generic.
Do you think, I guess, my second question would be, and I can always try a different form of it or push through what I'm doing now, maybe a couple more times and see if it goes away. But is there, what do you believe is the optimal dose if I'm going to stick with the topical, just to make sure what you've seen the best results with for somebody that's not afraid of a side effect? And then the second question would be, does it make sense to switch to, like, okay, you're getting a side effect from the finasteride. Is there people that switch to even like a low dose Dutasteride and do better with that just for side effect reasons?
Well, I'll hit your second question first, and then Joe could respond if he'd like, if he's not too busy.
Mm-hmm.
I have, and again, we're not physicians. I have known patients. They're not my patients of doctors that, we work with over the years. And I've heard this anecdotally as well, guys who've not done well on finasteride for whatever reason. They've had adverse effects or it wasn't working for them, who did really well on Dutasteride, on a low dose of Dutasteride without any adverse effects. So that's definitely a possibility that you can discuss with your doctor.
Mm-hmm.
As far as the best possible formulation or the best percentage of finasteride topically, I have no clue. I really don't.
It's too variable, and it's such a.
There's just not enough data.
Yeah, it's such a murky subject because I don't like different companies that have topical finasteride. They don't really make it a point to publish the actual amount that they're putting in,
Some do,
and I
but
don't think it's standardized.
yeah.
Like it's just referred to as topical finasteride or topical, mix with minoxidil, whatever. They don't go into topical, 1% or anything like that. It may be on the bottle. I'm sure it's on the bottle. It is on the bottle, but they just don't include that in the marketing language. They don't include that in the everyday vernacular when they're talking about it online, but they have to put it on the bottle. But it's just not thrown out there as much as like, oh, well, you take 1 milligram of Propecia, 5 milligram of Proscar, maybe cut that into quarters, take 1.25. Some people take this, some people take that. That's where you know the percentages. That's where you know the dosages. With these topicals, it's 1 squirt, and what's in it is whatever they put in it, and you have to read the bottle to find out.
I mean, they'll say,
Most of them.
the average one is like 0.5 milligrams. There's 0.1 milligrams. I've heard some, that go as low as 0.25. But I think the most prescribed and most of these compounding pharmacies are doing 0.5. So that's probably what you're taking, right?
Yeah, I think it's 0.05 is what I think it is actually.
0.05.
So 2, yeah, because it's diffused. So 2 squirts of it is like equivalent to 1 milligram. So basically 1 pill on top of the head. But
actually, I could be wrong I could be wrong. That's actually that's probably half the dose of the most commonly prescribed. I think it's I always get the zeros wrong. Don't ask me to do decimals. I think it's 0.1% is the most prescribed right now. And 0.05 is very common as well.
Yeah, and I was put on the 0.05 because I'm doing 2 full squirts of it for diffuse, so it's getting equivalent to that. But with the I guess titration for Dutasteride, what's the low dose, or how would you start on that?
I hate to give
I know Joe had the whole system for the
Joe's been on Dutasteride, so I hate to give advice just based on the information that I have from the internet and from some of the doctors that are prescribing it. I can.
Well, I figured
Joe has.
Well, I figured
personal
Joe
experience.
almost killed me with his. Joe almost killed me when I did what he said, so I figured you could try with the Dutasteride.
Well, listen. If Joe provides you with information that I think is questionable, I'm going to let you know right now. But Joe is actually on the drug.
I'll put it to you like this: if you had that type of effect from a quarter tablet of Proscar, which is 1.25, one shot from that knocked you out to where you overslept by 3.5 hours one morning. I think if you tried Dutasteride, I think I think the second generation after your kids are born will be asleep as well.
That's great.
Here's, and I'm being legit when I say this. If I were you and I wanted to try taking Dutasteride, I would do it on a weekend when I know I'm not going to have any guests coming over to pop in to say hello or any plans. And I would do it with the idea that you might not wake up till Sunday if you take it Friday. I'm kind of being tongue in cheek there, but at the same time, it's like if you had that effect on finasteride, Dutasteride stronger. And we don't know, like Spencer said, it could be the mixer and not finasteride. But I don't know what kind of low dose you could take of Dutasteride. Like the original Avodart is 0.5 milligram, and
most people, a lot of guys are being prescribed 2.5 milligrams. It seems to obviously lower DHT a little bit more, and there seems to be a more hair-raising effect. But the average guy,
are you sure? Are you confusing that with minoxidil 2.5? Because 0.5. Maybe I'm mixing this up, but I thought 0.5 Dutasteride was that much stronger than a full 1 milligram of finasteride.
Yeah, well, I can tell you
See,
that
now I'm confusing it.
in all the studies that I'm aware of, 2.5 milligrams daily have the most robust results for dutasteride, but that is not a dosage that most people are taking, the average person. Doctors are going to start you on 0.5, which is the dose for benign prostate hyperplasia.
Yeah,
And
0.5.
yeah, 0.5.
Sorry.
Yeah.
Yeah, Avodart is 0.5 milligram. Yeah.
Right.
Okay.
So do yourself a favor. I haven't done it. I could do it right now. Just look up 2.5 milligrams dutasteride hair growth and see what comes up. I'll let you do it.
Yeah, I'll do that. But what I was going to say is like a low dose of dutasteride.
I'm texting with a friend as we do this. So.
How much lower can it be? 2.5.
Well, they are. You're thinking. Well, here's the thing. The average, most dutásterides are basically in oral capsules, right? So now they're making dry dutasteride. Now, I don't know how great that is to take orally, but they're making dry dutasteride, mixing it with oral minoxidil, putting it into capsules. So it is possible to take a much lower dose now if you get it from a compounding pharmacy.
Okay.
So that's
all right. I'll try.
That's off the top of my head.
I mean,
I'm hoping Joe could take the time to look this up for you because I don't want to do it.
I mean, I'd like to try just pushing through with the finasteride, and hopefully maybe that stops. I've only tried it for I've tried it 5 or 6 times, and every time that's what's happened. But I'm hoping maybe that can stop. I don't know if you've seen that happen either.
Well, with a lot of drugs, including finasteride, side effects can be transient. And when it comes to sexual adverse side effects with finasteride, at least clinically, and all the anecdotes that I've heard of guys who've stuck it out, the side effects dissipated, gone completely away. They were transient after just being on the drug for, a week or so. However, this is a unique side effect, but there's no reason to think that your body won't get used to the drug as far as dealing with this side effect as well. So, maybe you need to take like a week off of work and give it a shot.
Okay. So here's what it says. I thought I was losing my mind. I'm not. So 2.5 was shown to be better than 5 milligram of Proscar. 2.5 milligrams of dutasteride better than 5 milligram of Proscar in hair loss studies, but it's rarely prescribed at that dosage because 0.5 milligram, 0.5, reduces up to 90% of DHT. And it's rarely prescribed at 2.5 for hair loss. Because of increased side effects.
Isn't that what I said, caller?
No, I thought you said 2.5 is more common for hair loss.
No, I said 0.5 is more common for hair loss. 2.5 was studied and showed that it had a greater effect.
I'm going to look at the transcript from this show. Okay, that's fine.
You should, because you're getting old. I'm just telling you. Listen, we're both getting up there, but I think you're starting to lose it a little bit, right, caller? Don't you think?
Just because his name is on the top of the show doesn't mean you have to agree with him.
He did almost kill you.
Yeah, you almost killed me. I almost missed my tea time because of you, Joe.
Don't say it too much. People will be like, Tillman almost kills a hair transplant patient. Next story up on Reddit.
No, I appreciate what you guys do because there's so much crap info out there, and it's good to at least.
All right, here's what I got.
And the doctor and everything.
2.5 milligrams daily, studied in research, shown to produce greater scalp DHE suppression and somewhat greater hair growth than 0.5 or 0.5 milligrams daily. But also, you have higher drug exposure and a greater incidence of side effects.
Yeah.
So I'm not going to say we're both right. You were right as far as your misunderstanding is concerned.
Mm-hmm.
And I was correct throughout the entire process of the conversation.
Okay. Okay. Anyway, so caller.
But how does this help the caller? It doesn't help him at all. This is what I would suggest. And then I'll let Joe give you his suggestion.
Yeah.
Is it possible for you to take an even smaller slice of that pill?
I mean, I don't think so. I have the Proscar, and it's in an 1/8 right now. So I'm cutting the quarter of a tablet in half. So I guess if I went to a generic, I could take less than that.
What about if you cut it in half, right? Cut the quarter in half and measure, get a shot glass, measure like, I don't know, 3 tablespoons of water, get a liquid syringe, create a suspended solution, mix it up, even though it's going to be it's not going to dissolve completely. Remove some of it with the syringe, maybe 2 milliliters, and take the shot. See how it affects you.
Yeah.
It's a pain in the
I
ass.
could try that.
I wouldn't bother. I would crush it, divide it, and
snort it.
Not snort it, but get your credit card and drop it under your tongue sublingually.
Okay.
Listen, let me just put this out there. We are not physicians.
Obviously,
we are not giving you medical advice. So please consult with your physician.
I think with anything, you're talking about lower dosages. I think with such a low dose to begin with, titration is also part of the key. Like you were starting to do with the finasteride, and just monitor your first dose, see how you feel, as always. But I'm serious when I say, like, make sure you know there's no plan for you to drive any heavy equipment. You know, you don't have to get on the farm and plow the back 40 or something the next morning. Just give yourself plenty of leeway before you take your first dose. See what happens. Maybe you have a great sleep for that weekend, and you wake up Monday morning refreshed, and you know what to do or what not to do.
Right. And how long would you give it on the finasteride before throwing the towel in? Because like I said, I've only given it 2 weeks.
Yeah. You know, that it's a tough one because your side effect is such a unique one. I mean, you're taking a quarter tablet of 5 milligram.
Proscar.
Yeah.
Yeah.
And did you say that you eventually cut that in half as well, the quarter tab?
Yeah. Yeah, I did.
And you had the same effect?
Yes. Yep.
Talk to your doctor, but it doesn't sound like finasteride's for you. Like I would say find a good topical.
Okay. Yeah, I'm on it.
Like,
I'm on one now.
like,
I have a good
yeah,
doctor,
I
thanks
mean,
to you guys too. So
yeah. Like if you can't, like, it sounds like there's no way you can take the oral. I could be wrong, but I don't see any way around this. Like if you take, what was it, half a quarter tablet would be,
I guess it would be like
0.65.
625. Yeah.
Yeah.
Look,
and there,
again,
so
you could talk to your doctor. I'm going to repeat myself. You can talk to your, if you really you want to try the oral again, you can talk to your doctor about trying a generic, know what the brand of that generic is, and see if you have the same adverse effect. You might not. Or
that would be a good experiment.
Or just stick with the topical. But if you really want to do oral, there are, I think, different options that most people don't talk about. We talk about brand because, you know, that's what I take. And I like the idea. Yeah, I like the idea of knowing exactly what I'm taking. And it's never going to be changed unless Organon stops making it. God forbid. And, you know, but some people, just like some people don't do well in generics, don't do well on the brand and might do well on the generic. It's very possible. Also, the generic can make you limp. I don't know. Don't listen to me. But talk to your doctor about it. If that's something that you want to try, it's always possible that for whatever reason, whatever the binders are, whatever is, you know, in brand name Proscar, just doesn't work for you. I mean, besides the finasteride component.
I'll give it a try. I appreciate it, gentlemen.
Well, don't try it on my account. Talk to your doctor about it. I'm just saying.
Oh,
and don't blame me if something happens.
If something happens, don't blame me.
It's Joe's fault. I'm writing a letter and everything. Look, next to the medicine before
if you get post finasteride syndrome, it's Joseph Tillman. I can give you his address.
That's funny.
All right, brother.
right.
Good luck.
Let us
Thank
let
you,
us know
guys.
what happens. Okay,
Bye.
keep us updated.
Thanks for the call.
I will do. Thank
Okay,
you.
bye-bye.
All right, good stuff.
Phone number is 888-659-3727. You make me second guess myself. I'm like, am I going crazy? Am I starting to get dementia?
Well, you already started with dementia. Like now it's my turn, and like I guess I misheard because I'm thinking I don't remember it that way. Like I've not thought about this in such a long time, like in detail. And it's like, wait a minute.
Well, you also have a lot.
I've been hearing
Listen, you have a lot
2.5.
going on. People are texting you just like they're texting me. There's a lot of, you have to multitask when you're doing this program. So I get it.
This is true. Let's take a break. Let's segue back into the headline of today's show. We failed to do this last week.
All right, guys, boys, hold on. There may be one.
This won't take long.
Hold on.
This
We'll
won't
take
take
your
long.
call as soon as Joe does his thing here, whatever that may be.
And my thing is today's hair loss news update.
All right.
According to hairlosscure2020.com, which is my source for almost daily hair loss and hair loss treatment news, great resource. We appreciate the fact that the administrator of this website is also a trusted content creator by the American Hair Loss Association. Good on you.
And one of only like a handful of trusted content creators.
Exactly. Artificial intelligence Ramsidil. LG AI developed hair loss compound. Ooh, sounds sexy. The number of novel AI developed hair loss products keep proliferating. The latest one is South Korea based LG AI research, and it's AI developed Ramsidil. It's a cosmeceutical type product, so there will be no need for it to go through any clinical trials. In fact, the company plans to release Ramsidil in 2026. LG, a multinational conglomerate via LG AI Research, has used artificial intelligence to develop a novel compound called Ramsidil to treat hair loss. The main ingredient, yes, I'm reading this from the website, the main ingredient activates a key estrogen receptor on the scalp. The company presented its new AI-developed procedure or products at last week's International Conference on Machine Learning in Seoul, Korea. There is a video attached at the bottom of the article. ICML, which is the conference, is one of the world's 3 most prominent AI and machine learning conferences per the Korean Herald, which is a newspaper. LG created a Ramsidil product using its flagship AI model Exodome, or Exo1. Their Exo1 discovery platform is designed to accelerate discovery of advanced materials and drug candidates. Ramsidil was discovered by LG Household and Healthcare in collaboration with LG AI Research. The latter used AI to screen more than 420,000 candidate compounds in just one day. That's amazing. Per the company, they say the ingredient has demonstrated hair loss prevention efficacy without steroid-derived compounds. The research behind this product was presented at the 14th World Congress of Hair Research that was also held in South Korea in May of this year. Ramsidil is being prepared for commercialization in 2026. And it goes on. But that's another development in the field of AI-led pharmaceutical research. How much is there to this? Don't know. It's just another story that keeps compounding on top of the stories behind it or in front of it that seem to be coming out every week. There's a new one. And they all seem to have some sort of smidgen of legitimacy, which is far more than we used to have in the past. So, yeah, it's another potential positive note to look forward to.
Well, here's what I know. Here's what I think. A lot of the stuff that is currently being researched, some of it may be a good adjunct to what we currently have, but it's going to come by surprise. AI and a couple of people who are going to be working with AI, it's going to be a completely different mechanism that we may not even understand yet and know about. And it's going to be like, holy shit, we just cured hair loss. Or we just found the treatment for androgenic alopecia. That's what's going to happen. You know, it's interesting. I agree. I maybe should or shouldn't talk about this. I don't know if it makes a difference, but let's just say that I was contacted by a company that surveys experts in the field about new drugs potentially coming out or new modalities. And they pay you to do this. and it's not a small amount of money.
Mm-hmm.
And the reason they want some insight for investors, people who are, whether they're venture capitalists or they are planning to do an IPO or whatever. So I have some information, insights that a lot of people, including physicians, may not present to these companies who are trying to gather this information. And I got to tell you, when I go out there and I tell the truth, sometimes I don't think these companies who are gathering this information necessarily want to share that truth because it may adversely affect the investment in these companies.
I was going to say the investments. Yeah.
Yeah. So I'm not going to say what that is. The latest thing is, but I was just contacted and we're going through the process. And I was like, are you sure? Are you sure you want this data? Because it may not be great for the company who's paying you to gather it.
Yeah.
So all I can tell you is all the information that's out there is great. I think Hair Loss Cure 2020 has done an incredible job for the last 20 years. Now, he missed the mark as far as 2020. It's 2026. But I get it. Why change the domain?
Yeah.
And he is a trusted content creator. And I mean, it's if anyone who wants to follow this stuff, it is the best resource, I believe, on the internet. Not Reddit, but Hair Loss Cure 2020. Anyway, we can take a phone call.
With that said, I want to address something in the chat room. I love peanut butter cups. I do too, actually. That's his username or her username, not sure. Says, I love you guys, but you're old school. Dutasteride is the way to go. Works so much better than finasteride. Well, first off, we love you too. Thank you very much. I'm going to tell you my experience with Dutasteride, not my personal experience taking it. I'll mention that too. But Dutasteride is not a new thing. It's been around for 20 years as of,
it was approved,
21 years, I think.
It was approved for benign prostate hyperplasia in the U.S. in 2001.
23. One?
2001. Yeah, I was still in New York, and it was right before 9/11, and there was a big front page article on the old Bald Truth site.
It wasn't really prescribed for hair loss off label in large amounts by any one clinic until around 2003.
Yeah.
And I happened to be at that clinic.
A handful.
Passing along. Yeah. And Dr. Hassan specifically was absolutely in the camp of Dutasteride. He said, this is a no-brainer. We put a couple patients on it and great results. But then as you start to have more experience with the medication, and this is firsthand, this isn't reading anecdotal evidence on Reddit or various forums or any of that. This is direct clinical experience. The attraction to Dutasteride started to wane, and here's why. There are cases that I remember very well where finasteride kind of did okay, but not as much as the patient wanted it to do or we wanted it to. There are cases where finasteride did sweet F all, did nothing. In some cases, even appeared to exasperate hair loss by inducing an effluvium from which the patient wouldn't really recover.
Are you telling me that it somehow upset hair loss?
Mm-hmm.
The hair loss itself was exasperated. I'm sorry. I'm fucking
yes.
It's exacerbated. I don't mean to be a dick. Go ahead.
What did I say?
Exasperated. It's exacerbated.
Exasperate.
That's the word.
Exacerbated.
Yeah.
Exasperated.
It's okay.
You knew what I meant. Anyway, I'm getting old. Hey, come on. What do you want?
I saw the hole, so I took a shot. Okay.
I will you can take it when you can get them.
Yeah.
The one thing that stands out though is I'll never forget this guy who was big on blood work, and he came in and he would tell us about his blood work with finasteride, and he wanted to try Dutasteride. long story short, I'll just cut to the chase on it. With finasteride, you discover that there is a decrease in seminal fluid through ejaculate. There's less of it. You're not shooting ropes anymore.
Yeah.
As Spencer likes to say.
Which I miss, to be honest. But go ahead.
With Dutasteride, we found out that it actually reduces sperm count, which was the fear with finasteride.
Yeah.
But there's no debating this. Dutasteride actually reduces sperm count. And with this particular patient, it dropped it to 0. And he stopped taking it. A year later, it was still at 0. Was it from Dutasteride? I don't know. But I'm not done. The side effects. If patients are not experiencing side effects with finasteride, they can still experience side effects with Dutasteride. And vice versa, obviously, side effects on finasteride, I've seen patients that don't have it with Dutasteride. But I can say the ones that did have side effects, they were worse. So when I throw in my own experience with Dutasteride, I've been on finasteride since 2002. There was a 2-year period where I did switch to Dutasteride. I got no improvements. And anecdotally, I believe that it contributed to a sense of bloating that I had. I only discovered in photographs looking back at the time. Nothing had changed in my life. But I do know, even put that side effect aside, it did not do anything above and beyond what I was getting from finasteride. So I think that when people talk about, and this may be your personal experience, and that's fine. I completely respect that. But in the grand scheme of things, when you look at real evidence and real experience with any medication, and I don't know where you get your opinion from, but I know that this is also the dominant opinion on the Reddits of the world. There's so much of that is hearsay and repeated sound bites. That's not actual experience. It's what someone read about from someone that talked about it, about their cousin and their uncle third time removed, whatever. It's not their own experience. My in-clinic experience for 11 years and speaking with many doctors through that time, Dutasteride can be better than finasteride. And sometimes it can be a lot worse. So I can't accept that comment. It's opinions are opinions, and you're welcome to yours. But I can't say that there's anything out there that tells me that it is definitely better than finasteride. Sometimes it is. Sometimes it's worse.
Well, I can say this, that from the beginning of my career, we were talking about Dutasteride potentially being approved. A dual 5-alpha reductase inhibitor that will suppress 90 or not to 95% of your DHT, and everyone was waiting for it in the online hair loss community, which was nuts back then, by the way. Mm-hmm. Talk about a dark place. Now, this is these Reddit places, and I mean, that's dark scaled in a way that I could never have imagined back then, but it was dark. So we would talk about it in the program. At the time, The Bald Truth was a kind of active, and it was a different type of a website, so we'd write about it. I was actually asked to write an article about it for AskMen.com back in the day, which I don't know if anybody even looks at anymore.
Ask Men, yeah.
I blew a big opportunity with Ask Men, too, because I was like, this guy was trying to rush me to write an article. I'm like, who the fuck are you? I'm a published author, yo. And then it became like the biggest men's health website in the world. And I didn't get, and they basically I could have a good opportunity. But anyway, so could have been their hair loss expert from the beginning. I blew that one. I learned a good lesson, though, on that. I tell you, I learned a really good lesson. Like, what? I'll take my sweet time. I don't work for you. So anyway. God,
do you know who I am?
Yeah, what a jerk. The guy just rubbed me the wrong way, and, whatever, it happens. So we were all very excited about it. And I actually made a comment on someone's Facebook feed. I'm sorry, their Instagram feed. There's a bodybuilder who's talking about how finasterides was so 10 years ago, and you have to get on Dutasteride now. That's really what everyone's taking. And I wrote a comment, essentially, and someone then wrote back and said that they were doing well on finasteride. As soon as they got on Dutasteride, within weeks, they noticed a significant shed, and now they don't know what to do. So I just said, look, it happens. I explained why, and there was kind of like a lot of people talking about it. So Joe's 100% right. Dutasteride can lower more DHT, but not everybody needs that, first of all. And for some men who are already doing well on finasteride, jumping on Dutasteride only makes things worse. Take the side effects out of the picture. And Joe's right. If you do have adverse side effects with finasteride, sexual or otherwise, it's a 5-week half-life. That means the drug can stay in your body for 3 months. The half-life is 5 weeks. Those side effects can be, you're talking about long-lasting adverse side effects. So in my view, Dutasteride is the last resort as far as DHT blockers. Now, I know a lot of young guys, one of their questions to me is, when should I switch to Dutasteride? Like, this is kind of like, finasteride is a stepping stone. And I'll ask them, how long have you been on finasteride? It's been a year already. And they think that taking more or lowering their DHT more is going to get them to have better results. And then the next question is, how are you doing on finasteride? Great. But they want more.
Mm-hmm.
It's illogical. It doesn't make sense. Why put yourself at risk of worse adverse side effects, longer lasting adverse side effects if you do suffer from adverse side effects, especially if you're already doing well on a medication? That's all. That's all we're saying. So if you think that's old school, then I guess we're old school. I mean,
I'll take that.
I was born in 1965.
Yeesh.
The year of the Voting Rights Act, okay? I mean, that's how old I am.
It's good.
Let's see who this is.
Anyway.
Let's take a phone call. That's so funny. So you said, hold on. Are you listening to me, Siri? That is fucked up. I thought I turned her off.
She turned herself back on.
Yeah. I hate these things, man. Let's see who this is. Hey, you're on the air. Who's this and where are you calling from?
I was born in 1966 and it sucks. Spencer, Joe, how you going?
Adrian, it doesn't suck.
Adrian
The fact that you're still able to string a sentence together and you were born in 66, that's amazing.
Good for you.
Yeah, well, I'm still here. True. This is true. Yeah.
Yeah.
Absolutely. I was just calling back, guys. Joe, thanks for the feedback regarding my hair last week. I managed to get an appointment with my dermatologist, with Dr. Bevan Boyrell at Sinclair Dermatology, and it was quite interesting. I was pretty paranoid about my hair, and I felt like a catfished woman on a Tinder date. But I managed to get in,
and he said, "Wait a minute, you talked to Joe Tillman, and you're still coming to me? What's wrong with you? Everything he said is 100% correct, right?"
It's something along those lines, but he still charged me $360 for the pleasure. But anyway, I'll give him that. He's very good. He's worth his time.
Yeah.
He said to say hello back to you, Joe. I did pass on that message to him.
Right on.
And so it was interesting. We took the photos, and then he pulled up some photos from 2 years ago and compared them side by side with photos of that day. And it wasn't as bad as I thought. Like, I remember taking those photos, those sundowner pictures, Joe, and sent you, and I thought, God, it looks like I'm a balding man. But
those were terrible photos, man. Yeah,
it was very.
I told you it was the lighting.
Yeah.
It was the angle of the sunlight. Yeah.
Yeah. It was all washed out, and but we had a look at basically the frontal area, and he pointed out. He said, "Look, there is a little bit of miniaturization here. And I mean, we're talking. It was like looking at trees. These hairs, and he pointed out probably half a dozen. And then he said, and I could see though overall something was different. And he picked it up straight away, and he said, "But hang on, look at this." He said, "Your SMP has almost disappeared." And I've felt this way about my hair for about a year. And he said, I'm not saying this to, piss in your pocket. I'm being honest. I think the SMP now makes a big difference because the hair count kind of looked the same. He said, look, you're probably miniaturized. He looked all through my donor, etc. And he said, look, you're probably miniaturizing less than 5%. But overall, I think the visual difference is because you don't have SMP as you did, post 12 months from the first procedure.
Yeah.
I didn't either. And then we looked at photos of the crown before.
Oh, so wait a second. So he said, so your SMP faded? Is that it?
Absolutely, yeah. That's right, Spence. And I hadn't thought of that.
That's interesting.
And then I thought, hang on, yeah. And so we looked at the hair under super magnification today versus 2 years ago, and it's not a lot different. There's only a couple of sort of spots in the behind the hairline maybe where he said, look, a few hairs are miniaturized. You can see this one and this one. But we're talking like half a dozen. Not as bad as I thought.
That's
and
great.
He just suggests, so it was something I didn't even think about. I was sort of, and then of course after that, when I went home, looked in the mirror, I suddenly saw a full head of hair. Like this placebo, nocebo thing is insane. But he did give me a script for topical finasteride 0.25%, and he wants me to apply it just to a little small area, the area where I felt that it's sort of miniaturizing or not looking as good. And I'll see how I go. I've tried topical before. I got sides after a while, but I was probably splashing it on like a hair tonic, So I'll just stick to one area.
Remind me, I know that you had sides on finasteride. I thought you started taking oral finasteride and you weren't having sides. I did.
I went back on because of the creatine. I just thought, screw it. I'll take finasteride, hoping that it might block any negative effects from creatine. But with the creatine, I don't know. I was going to go off it completely. But after seeing Bevan, I asked him about the creatine. He's sort of a bit on the fence. He said, well, look, the last study was pretty flawed. The 2009 rugby player one in South Africa was obviously flawed. He just said, I don't know. He takes it himself, but he doesn't experience male pattern baldness.
Yeah.
So I don't know. I've been on the creatine now for probably over 3.5 months, and the only thing he picked up was the SMP, which makes sense because if I look at my temple peaks, I mean, they're looking thinner because, of course, there's no SMP under it.
That's true.
And I've been aware of that for a while, but I didn't think about the rest of my scalp.
Now, what's interesting
it was a positive.
Did you get what you thought was a permanent SMP back in the day?
Well, as permanent as it wasn't trichopigmentation, it was SMP, that's right. But I had it was 10 years ago now, nearly 9 years ago.
Amazing, yeah.
Was it that long ago?
And I'm not going to have it. It was 2017, 9 years ago.
Wow, I didn't think it was that long ago that
we haven't known you 9 years, have we?
Yeah, it is.
Well, Joe, I think you reached out about late 2016.
I hooked you up with Caitlin for the SMP.
What the fuck? I mean, where is time going, man?
That's 10 years. 2026.
Yeah. It actually it was because I called you. I think it was well before you went to Caitlin because we were talking about your scar revision and we were talking about different clinics to deal with that first. So was that at least 10 years? Wow. I didn't realize that. Damn.
And look, I remember, because Dr. Barty came out to Melbourne for consultations, and I remember in our communication, I said, look, I'll see. Thank God I didn't pull the pin then. No disrespect to Dr. Barty, but I would have jumped out of the pan into the fire if he said yes, and he said no. He said you're not a candidate, as did about another dozen surgeons, from around the world.
Mhm.
So sometimes your poison is your cure.
Well, you
I was
definitely,
lucky
I definitely
because
think that. Well, listen, everything was screwed up when you were young, and these guys really took advantage of you. You are one of the few
oh
guys
hell yeah,
who were in a position that you were in that kind of came out the other side. That's so unusual. You know, these kids, it's interesting. There's a guy online, I think his wife somehow hit it big on TikTok and they made a few $1 million. And um, she ended up buying him a hair transplant in Turkey. She went in to get some other procedures. And I watched this guy online. I don't make any comments. I posted one thing that kind of shows the example of what was happening in Turkey a while ago. You can see it on my feed, but I don't comment because he seems to be happy with what's happening. He's 6 months in.
Mm.
And when I see the growth on his scalp, I can't even believe, like, as damaged as you were, the level
yeah,
of damage that this guy is dealing with, and he doesn't even know it. He thinks it's normal. It's frightening to me. I can't even, he thinks it's part of the process
yeah,
that his donor has not fully grown in yet. I mean, he thinks that's part of the
yeah.
process. He's discussing, he's telling people to go to this company. I
I
don't
know
know
what
if he's
you're
getting
talking
paid
about.
or not. You do. He's like a Southern guy. He seems like a really nice guy, a little dopey.
Yeah.
You know,
It seems like the wife wears the pants in the house.
yeah, a nice looking guy, young. He's got a kid, but he seems like a real idiot.
Yeah.
Like he's a real low IQ dude.
Doofus.
Are we talking about? Are we talking about Cole here? Who are we talking about? Southern don't. Anyway, sorry. So
I didn't say he was
think it's a
drinking, did I?
Oh my gosh.
Sorry, he wasn't an alcoholic. No, teetotaler.
I didn't say that. We did not, at the Ball Truth, we do not
That's all
endorse that commentary. Go ahead.
Absolutely, and they can pay me back on Facebook like last time with his daughter. But anyway.
Wasn't that something? I hate to say, I don't want to speak about anyone's family. That really did.
What a nasty comment.
What a
really, nasty person.
That really highlighted their upbringing. And, you look at a guy like him and then you see his children and you're just like, okay, they had to have grown up in the same household.
Man, the apple didn't fall far from the tree, I can tell you, on that Facebook chat that day. That was crazy. I'm glad it was me. I'm glad it was me, because if it was some young, vulnerable guy
it would have destroyed them.
Had a surgery, it could have killed them. Yeah, it would have destroyed them.
Yeah, 100%.
For me,
you saw it for what it was, and you
Yeah.
pitied her more than you took it personally. It's like,
I mean, one bad comb over crack from her, I would have gone into the whole olive oil thing. It would have been terrible. I would have been nasty, man. You really handled it well.
Yeah, kudos to you.
Well, I tried to be diplomatic about it because it is. I just saw it for what it was, you know. But look, look what you're saying about this. The guy with the results or whatnot, that he thinks it's normal. I think back to '85 when I was 18 and I had those 2 stupid punch graft surgeries, and there were guys walking around at the time with plugs, and they were thinking, well, at least it's hair, man. You know, they made that. Some people were trying to make it the normal.
Here's the thing. I think they accepted it. And what's interesting is when I got into the field, I would speak to some of these physicians, whether it was the Youngers or, people who knew Norman Orenreich, and obviously he wanted to perform surgery on me. And they would say, I think actually Walter Unger told me this once during a conversation. I had one kind of later as he was considering retiring, I think. And he's a very nice guy. Don't get me wrong. I mean, I actually, I don't want to say as a person, I like him. I think there's a lot of unfortunate things happen based on the idea that he told me this, that when he first started to do surgery, he was like, this doesn't really look that good, but patients kept coming back and they wanted more and they liked it and they would thank him.
Yeah.
And he felt that he was doing something good, even though it may not have been to his aesthetic liking. And I found that fascinating, but I also understand it.
Yeah.
There was there's a group of guys who had it done, and they were so desperate to have hair, they were willing to walk around with 4 millimeter plugs in their head,
Mm-hmm.
Yeah.
and they were cool with
Yeah.
that. So in a way, I can't blame him. In
Yeah.
a way, I do, because it's kind of like if I was in a position where I'm performing something on somebody, and even though they may appear satisfied, you kind of know that you're damaging that person. In my view.
Well, I had the good luck of having an appointment because I fell under that kind of more must be better because it might hide the bad work, but then you're just going from bad to worse. I had an appointment with Dr. Richard Shields, who's still alive.
Oh boy.
No,
before he-
I think Shields probably told you the truth. No.
Well, you know what he said to me, and I think back then I had my first or second repair job by then, so I had this big raised red scar, FUT looking scar across the top of my hairline. Well, actually, it wasn't that high up either. But he looked at me and he said, "Look, if you gave me $1 million right now, I wouldn't touch you." Those were his words. And
But the question
thank
is,
God
would he
for
do a
that,
hair
because
transplant?
Oh, hell yeah. He had a vacancy the next day, but that's beside the point. No, he just said, I wouldn't. Boom, boom. That's touche. Or toupee, whatever. But
Or toupee.
he had that character and honesty to know where that would end up. You know, it's bad enough as it was. And it was him that said to me, it was Dr. Shields that said, "Come back next week. There's a young guy your age. He wears a hairpiece," which I balked at the whole idea. And I did, and that began wearing a hairpiece, which hid the scars and gave me more time in terms of just staying away from the whole thing.
You know,
And I
what's
kinda liked
interesting
it,
about
and
Richard and about Shields is that, you know, he listen, back when he was doing it, and even, you know, I mean, it was hair transplant surgery was what it was, and a lot of people were resistant to change and evolving their practices, and I think he was a good guy. And I don't think people give him enough credit for that. And he was always incredibly nice to me and very respectful when his colleagues weren't, honestly. And when he saw me, you know, and I was young, I just remember him coming up to me and he was like, you know, "Congratulations on all your success." And he said something, I mean, I'll never forget it. He's like, well, I guess I did forget it, but it's basically something to the effect of, "I know people are giving you a lot of shit, but keep doing what you're doing." And he didn't even know me. He just read my book. He became a fan of what I did. He knew that his buddy Otar Norwood wrote the cover blurb for my book and really supported my work. And and he was a politician too. It was very nice of him. I was like 30 years old.
Yeah. I really feel a depth of gratitude towards him for knocking me back, and you know, it saved me from jumping out of the pan into the fire. Fuck, I don't know where I'd be now. I would be one of those guys that you see that has scars all over their scalp with just tufts of hair here and there.
Yeah.
You know, I'd be one of those early Dr. Umar patients, you know, where he first started using body hair and beard hair and whatnot, and SMP, and that would be the best outcome I would have got. So I'm so glad he pulled me up. And he later on did one of the repair strips out of my hairline as well. But he was a lovely guy, yeah. But so look, it's not as doom and gloom as I thought. I really need to get on a 5AR inhibitor in terms of it's got to be, you know, in terms of a long-term game plan, because it is mandatory. You know,
you're 60.
But again, look. Well,
what kind
of
long-term game plan are you expecting? I'm just kidding. I'm older than you, brother.
Have you heard the concept? If you heard the concept of reincarnation? No. The other part I thought was this. I thought, hang on, if this gets me to 70, which is not very far away.
Yeah.
I thought there'll still be hair there. There'll still be at least beard and pubic hair, whatever. There'll be something there. So I'm a lot more positive, and I'm just, it took a big weight off when he did mention the SMP, because that's something I did not think of at all.
I'm so glad that you saw him and that he was insightful enough to see that.
I thought, I spoke with Joe. I just sent Joe a message and whatnot and some photos, and Joe gave me his advice. And
Joe's like, "Oh, you're fucked."
You read his phone? My God. But I rang the clinic and they had a vacancy the next day, so I grabbed it. So it alleviated a lot of the worry. But yeah. So
you should tell him that he's charging too much, and you're a friend of the Bald Truth. I mean, come on.
Hey, good point.
Yeah.
We'll split it, yeah?
Yeah.
50-50, the rebate. You take half, I'll take... I didn't think of that.
Yeah, come on.
I've been speaking with Graham.
Graham's
like a fat kid. He's like a fat kid on chocolate. Nothing's happened. He hasn't even shed yet, and he's like a fat kid on... His scabs are still there, and he's a fat kid on chocolate. He's so happy.
Well, he showed me his 8-day out donor, and the hair's already starting to grow back, and... I'm not going to keep posting it, but when I told him to, I'm going to share it at a month for people so they could understand and comprehend what the donor should look like a month out. Now, granted, he had 1,900 grafts, so people are going to be like, well, he only had 1,900 grafts. There was a time when 1,900 grafts was a mega session.
Oh, that was big,
especially with FUE.
That was huge.
And
that's actually a lot for the area that he had work in. Like that's a healthy amount.
So even if you doubled that, and it was a 4,000 graft, and they went up even further above, his donor, his quote unquote safe zone. He's already in his 50s, But even if they went higher, the entire look of the scalp would have been homogeneous, just like it is now. Mm-hmm. And as things grew in, people would have been able to see how normally things grow in. So even though these idiots are going to be like, well, that's a small case. It's not a small case. And it really does, I think, illustrate how well-executed FUE extraction can look.
Mm-hmm. 100%.
So I want to highlight him. I definitely want to highlight him. It's funny.
Yeah.
I told him, I said, listen, I'm not going to tag you in this. You don't want all these nuts bothering you. And he's like, yeah, it's a good idea. I really don't want to deal with that. And then he's like, he comes on the thread and he's like, he thanks you.
Yeah.
For the comment that you made about it. I'm like, what are you doing? You said you wanted to be anonymous.
Yeah. Yeah, no, he's a hell of a guy. He's a great, I've known Graham for about 6 years now. He's a wonderful guy.
No, he's a super wonderful guy. I was just like, Jesus Christ, I kept you anonymous for a reason.
I hear what you're saying. I know what you're saying.
Yeah.
I know. But now he's going to be inundated with requests for Instagram. But
he's going to be target because he's a friend of the show.
Yeah. He's going to have to change his Instagram page. He's going to take his kid off of there.
Well, he probably will when it grows out. He's super happy. But I saw the comments, and I can almost tell how old they are and what their experience has been. And at a young age, it's very little, So it's good that you posted that up. I kind of appreciated that too.
Let me see. I'm looking at it now.
So
it's got like 76,000 views. It's pretty good. I mean, that's not hay. And it's got a decent amount of comments. It's only going to grow. So I think a lot more people, and then I'll do a part 2 for him. I think it's really important. I think it's super important that people see this. And I told him that. But yeah, I think that can really give some people just an idea of, all right, all the bloody messes that you see online post-op, that's not the way it's supposed to look.
No.
So, but listen, man, I'm glad that you have some relief, some emotional relief from seeing your doctor. And
thank you.
It makes a lot of sense. The SMP is faded. So it's not going to look as thick.
Yeah. And I spoke to a couple of people, friends, and they said, oh, why don't you get it done again? And I said, no, because I'll be in the same exact position in another 9 years.
Well, I mean,
when it starts fading again.
If it gives you 9 years, that's a long. At our stage in life, that's a long time. But
Exactly.
you also don't know if you want to deal, I mean, you still have to get your head tattooed. Do you have any other tattoos, by the way?
No, I don't. I'm pretty much in free outside of that.
So we don't know, like, especially when there's that much tattooing throughout in such a major area, we don't know how that affects, how it can get clogged in your lymphatic system.
Well, that's right. I don't want to be. Yeah, I don't want to be sinking shallow needles into that area that's all been transplanted. It was different before.
Yeah.
Before surgery, but now, exactly.
So
exactly.
I mean, you could always use a little dust. Just dust it up a little bit.
Little makeup, little dust.
Fibers.
Yeah.
But then if I look at the average guy, I'm nearly 60. I don't know if I said that before. I'm nearly 60.
I think you did.
And
you might have mentioned it.
Maybe once or twice I inserted it. I'm not sure. But anyway, I'm nearly 60, and December 5th, I'll be 60. And the average guy my age walking along the street, I mean, I look good.
You have a lot more hair than the average guy. Listen, when these kids like goof on my like I have a receding hairline, I think to myself, sometimes I say it, but like, do you have any idea? I mean, I don't know what's going to happen with AI, but in general, do you have any idea what a 60-year-old man's head of hair looks like? Generally, even with a full head of hair, it's very rare for someone not to have a receding hairline at 60, let alone enough hair to comb over. Like, you guys are idiots.
Yeah, I know. So I feel good overall because even just weight wise, the average 60-year-old's like,
Oh, you look good. I mean, I saw some images. I saw one of you in the gym. I mean, you're looking good, brother.
Yeah. I feel good, and not just the hair. I mean, just overall, I'm sort of more health conscious, I guess you call it, in that, I want to be functional. I want to be doing this shit at 70, 80, whatever.
Dude, that's what I'm thinking. Like I had some tendon issues I talked about. I've been going to basically rehabbing myself, and I am getting strong again. And it's a process, but I'm like, I could see when I wasn't able to train like I wanted to, I'd eat a little bit more ice cream, and I put on a little bit of weight, but just the body was not what I wanted. And then within a short time, even at this age, it's already bouncing back. People our age in general, they give up because it's hard. If you don't exercise on a regular basis and make that part of your life, everything gets harder at our age. That's just the reality of it.
Absolutely.
But if you're consistent, it's part of your life. Like I got up today. Yeah, I had to do the show. I had to do whatever I had to do. I had to train. I had to get my treadmill in, and then today was leg day. I had to train. I won't even take an email unless it's super important before I get my workout in. Joe could be calling me first thing in the morning. I'm not gonna pick up. Fuck him.
I don't even bother. I just text.
That's true.
Yeah.
And he messages back saying, "Do you have any idea what time it is? I'm almost 61. I'm 61, almost 62." I'm like, Spencer, it's 10:30 in the morning. What's wrong?
That's early. Dude, I will not take a meeting. It has to be after 11. That's just the rules.
I'm not a morning person.
You also said you won't take a meeting unless you're wearing your underwear. So
that's true. No, I do get up in the morning. I get up pretty early, but I don't like to. If I don't have to conduct business early in the morning, why should I? Fuck them. They could wait. If it's important, they'll wait. Look, we're at a point in our lives now we don't have to hustle anymore. You're retiring soon, right? I think you said that, or you maybe
next year, buddy.
Yeah.
No, next year, man. It can't come quick enough. I'm at work right now, and if it wasn't for work and talking to you, I'd be in bed. I'm not a morning person either.
All right, but let's
sleep, baby.
We're gonna take another call.
All right, great chatting. Love you both. Not full homo, obviously, but love you.
Love you too, brother. No homo.
And all right,
thanks,
and
buddy.
God bless. You have a great weekend. Thank you, Joe, too, man.
Yeah, take care, man.
Later.
Okay, buddy. Bye.
He thinks the not full homo went over our heads, but I heard that. The not full. I get it.
Not full homo.
It's okay if you're a partial homo. Nothing wrong with that. I'm cool with that.
You tell me that all the time, so yeah.
That I'm fine with you being a partial homo?
No, that see, we could keep going in that direction.
Yeah, but I'll always win. Let's see who this is.
You think so. You think so. Oh, I got a good picture to show, by the way.
And that's really all that matters, right? At least in my life.
It is. This is good. So this is me right before coming here. Hold on a second. There we go.
You look like the Invisible Man.
Yeah, I know. It's like, why isn't it? It's so bright. Hold on. It's not that bright.
I'll give you a hint. Make it less bright and see what it looks like
on my phone.
Yeah,
seriously,
phone.
How am I supposed to do that?
You have an iPhone, right?
Yeah.
Swipe.
Oh, here it is.
Diagonally, and turn down the fucking light.
Cancel. Swipe diagonally.
Swipe diagonally from right to left. Top of the right screen to the left. Fast.
Doesn't work. It puts it back in the gallery. Let's see. Let's see. No. Oh, wait. How's that? Is that better?
Let's see.
Anyway.
It's a little better,
That's
but
terrible.
I mean, you definitely
it looks like a mohawk.
Man.
Looks like a mohawk. Okay, here's my hair out in the sunshine. Shit, still not working. Never mind. I'll post them up later.
Would you? Would you please? Because you're ruining the show.
Links in the description. Would you get to the caller, please? This is a damn call-in show for
Let's see who this is. Hey, you're on the air. Who's this and where are you calling from? Please forgive Joe, by the way.
Well, he's been forgiven for many years.
Okay, good. Who is this?
Thank you.
It's been a long time. This is Gypsy from LA.
Gypsy, what's happening?
Gypsy!
Brother? How are you?
Hey, I'm doing good. Can't complain. And even if I do, no one's going to listen.
That's true.
It's status quo.
That's my line.
Status quo. There you go. So, yeah, it's been a while. I thought I called in and just...
Have you stopped smoking yet, Gypsy?
No. And I know that's not the answer you're expecting, but I am on my way of decreasing.
You're on your way on to what?
Decreasing.
So you're taking creatine?
No.
Oh, decreasing. You're decreasing your smoking habit. Good.
Exactly.
How old are you now?
I just turned 50 this year. Can you believe it? I'm almost 51.
Jesus Christ. I cannot believe it.
Right. So that...
You old man, I'm telling you.
I know. That and started to pick up on the activity, being more active, working out a little bit more.
Good.
Trying to keep a routine. My vitamin D levels are finally where they were supposed to be. I don't know if you remember that whole saga.
I think I do. I remember the smoking. I remember the vitamin D, but I don't remember the saga. I remember that you said that you had extremely low vitamin D.
Right, and then I went extremely high.
Yeah.
And then now they're stable now. They're very stable.
Okay, good.
So yeah, those so on that side is good. Increasing the protein intake, just try to do as a...
How much you smoke? I'm not judging. I'm just curious. How much you smoke a day?
So it was 1 pack a day. So now it's a pack every 2 days.
Okay, so you're down to 10 cigarettes a day. That's not terrible. I mean, it's all bad, but still,
yeah,
you wouldn't be considered a heavy smoker. Listen, I love cigarettes, man. If I knew they weren't going to kill me, I'd be smoking one right now.
Well, but something's going to kill you. I mean, I'm not making an excuse. It is a bad habit, and I'm the first one to admit it.
Well, that looks good, Joe.
But if it's not the
oh no, listen, something's going to kill you, and it's very possible that my past smoking is going to kill me. I don't know, but my mother ended up with emphysema, and she died at 73. So,
Right.
I didn't want to deal with that shit.
Yeah.
So,
Well, my grandmother died from, but she was 93 already. Cancer, and I think it started as colon cancer. So that's the thing that I think just genetically I have to look out more for that. Doesn't excuse the smoking.
I'm not judging you for the smoking. Like I told you, I would be smoking a Marlboro Red right now if I didn't know it was going to affect my health adversely.
Yeah, cowboy killers.
Yeah, I'd just be sitting here lighting up on the air. I don't give a shit. I'm not trying to be anybody's role model here, but it's going to kill me. I smoked as a kid. I started young. My parents were smokers. I mean, I was born in the 60s. It's a totally different world. But, as I got older, I was like, I just can't do this. And I would chip, I'd get drunk and smoke and stuff like that. But in general, it has not been a part of my life in a very long time.
Yeah. But well, let's see where it goes. I mean, I've stopped before twice, not because I needed to, or because I wanted to, or I was trying to quit. It was just one of those things that it felt right at the time.
Yeah.
Like at least to take a break. I never had the mentality. It's like, oh, I'm quitting because I need to quit. And even right now, the same thing. It's not like, oh, I'm shooting for quitting. Right now, the goal is just, well, let's see how much I can decrease it. Go 2-3 hours without it. Okay, after a meal, that makes sense. That kind of stuff, and then see where I go from there.
Okay. Well,
yeah, but
you're on your way.
Yeah, it's something. You got to try something new, or it makes sense to me at this moment. I might change my mind tomorrow.
So, can we answer any questions for you?
Well, not really. I mean, I have a little bit of updates, and I do have a couple of comments. Especially, I'll start with Joe. I know he was doing the oral minoxidil, and back when I did one of my last 2 calls or something, I did mention to you guys that Canada had Lonitin. That Canada was actually manufacturing it. So I saw when he got it, and he was surprised that it was Lonitin. But I was trying to get my hands on Lonitin. It's not as easy as just getting online and ordering it. I even asked my GP to write a script, and he's like, yeah, I can do it for Canada. So what I found out more or less is that you basically have to go into one of these online services where they provide you an online consultation, and then they send the script to the pharmacy. As far as Canada rules is concerned, whatever I found out is that now their doctor on the Canada side has to kind of certify the U.S. side, and then they will send you the medication. And by law, they can only send you no more than 90 days supply.
Wow! So you're actually, that's a way to circumvent the law, basically, but get your Lonitin. Listen, if I start to take it, that's what I want to do.
Yeah. So basically, I mean, even some of the pharmacies, you have to do a little bit of research on the pharmacies, and then the so-called accreditation or certification, organizations. But they even kind of provide. One of them provides a link to where you can go to this U.S. physicians. Obviously, they will charge you like, I don't know, it ranges $40 to $80 for the consultation, and then they will write you the script, and then yada yada yada. But the thing that I wanted to mention about
hold on for a second, Joe. Should I spend $152 on a meal from Uber Eats? Is that crazy?
Well, it's not from Uber Eats. It's they're not making it for you. So
no, it's from STK Steakhouse, and I felt like a good steak with some expensive
it's
stuff.
It's definitely worth it. Yeah, absolutely.
But if I go there,
it's a good steakhouse.
If I go there, some chick's going to be hitting on me. So why don't I do that?
You can go to the seniors home, and they'd still hit on you. And you don't have to buy
true.
dinner.
Yeah, tomorrow's pizza night there. So, right, brother.
You can go to
Sorry to interrupt.
That's fine, Spencer. You can go to West Hollywood, and they will still be hitting on you.
Oh, Jesus. Are you kidding me, man? It's funny. West Hollywood's destroyed that water main break, man. Did you hear about that? Water main busted in West Hollywood. I mean, this city is just really, man. I know it's a separate city. All these cities are separate. Just falling apart, though, man. The infrastructure, it's almost like no humanity here. The politicians, the policies, they've destroyed everything. God almighty.
Yeah.
Go ahead.
You had to get them started.
And, well, no, I'm in the same boat because I think that this mayor election was a comedy show. But
let's put it this way. I've never seen so many people waiting to vote in Beverly Hills. I've never seen anything. I actually got a sunburn. But I was like, you know what? I'll vote in person. I have never seen that. I've lived here for 25 years. And this is especially for a mayoral election. I've never seen it.
Mm-hmm. Yeah. Well, I'll tell you what. I never ever voted in my life until this year.
I don't know if I'd be broadcasting that, by the way, but I'm glad that you did. I'm just kidding.
I mean, it's something that I can or cannot exercise, right? But I actually went in person and did the same day registration and everything. And I was very surprised that I'm like, do you need my ID? He's like, no, unless it's necessary.
Oh, you know how nervous they get? You pull out your ID. I like to just pull it out.
Yeah.
To watch them get nervous.
Oh, hey! What are we talking about here?
You know, dude, it's like you have to go. Do you have to show your ID to get cigarettes? Even at your age, you probably have to show your ID here in LA.
Yeah.
So
you have to show your ID for everything. You know, it's just. But anyways, back to the minoxidil. So, Joe, yeah, you do. I experienced the same thing as you when I started taking oral minoxidil.
Really? Thank you.
Yeah.
Like, I'm sorry to hear that, but yeah.
So, under the eyelids, a little bit of flaking and itching, right? It goes away. At least for me, it did. So it goes away. The itching comes back a little bit here and there, but it does tend to go away. And the itching on the beard, I also experienced that a little bit. And I figure that probably on the beard side is probably because, it's making the hairs a little thicker or they're coming out a little bit more aggressive. But I would say that, kind of like the recommendations that you give is like, stay the course and see if you can power through it. That would be my take. But I did experience
that's a tough
talking about it.
That's a tough one to deal with, but yeah. Okay. No, it's good. It's good to hear that it cleared up for you. What you still pushed through and it worked out.
Joe was peeling like a boa constrictor. That's the problem.
Peeling
I was worse.
Like a crab.
Mm-hmm. No, I saw it. I was worse. I was definitely worse.
Really? Okay.
Yeah.
All right. Yeah. Good to know. Good to know. Validates my issue.
So
Thank you very much. Glad that yours cleared up with continued use. That's good.
Yeah.
I might try it again. I might try it again.
Okay.
We'll see.
Well, I just thought I'd mention it. As far as overall, I think I've progressed. Well, no, actually, I don't think it. I definitely have, especially on the right temple side type of thing.
What do you mean progress? Progress with more hair loss, or you progress with recovery?
Yeah, no, with hair loss.
Okay.
With hair loss,
yeah.
Is not terribly bad, but you know your hair, you can tell. The thing is still there, and whatever.
A little bit's bad. It doesn't have to be terribly. It can still be a little bit and still be bad. Like any loss is bad, but I get it.
Well, yeah. So it's So what I have is basically whatever I recovered through the medication, which is basically is not so much vellus hair, but somewhere in between vellus and mature. I still have that, and they still come in.
Okay.
It's just the native hair. I've noticed that it is the thinning is pretty much the same, but I've noticed a little bit of loss in some areas. So it's probably my it's not a forelock, but more like the frontal third. That's where it's kind of like noticing a little bit of a loss. And again, especially on the right hand side of like the temple point.
Mm-hmm.
And I know you mentioned that that typically is where it is more experienced than on the left. But
that's interesting. That everyone's temporal point. My right temporal point is weaker and further back.
It's normal.
Than my left.
Right.
You can't really see it head on unless you really look for it, but it's there.
It's a temple point or temple peak, right on the top. Yeah.
Both, but
there's temporal points, and then there's what is it called? Temporal angles.
Angles, peaks.
Well, peaks are here, and angles are your recess where the recession is, or where it can be.
Okay, close to the head.
And Joe's going to question me on that, so you can look it up, and if I'm wrong, let me know right here and right now.
No, I'm not going to question you because I know the real answer, but I don't want to distract from the discussion here.
I saw your face, and I want you to look it up.
I didn't say anything.
See the difference between temporal angles and temporal points.
I resisted.
I'm going to look that shit up while we're on the phone with this guy.
But you'll get different definitions depending on the page that you're looking on.
Yeah. All right. So
the point is okay. Both you and Spencer are right where you're talking about the temporal recession in the corners, as Spencer calls it, or the peaks, which is also the same thing, and that's normal to be more on the right side. But also the temporal point that can also be further recessed, or is further recessed than the left usually. More than 9 times out of 10, like 9.8 times out of 10. And that usually corresponds, here's a little known fact, it usually corresponds with the rotation of your crown whorl, which is also the same percentage, the same, statistically speaking, is clockwise. If it's more recessed on the left than is on the right, then it is usually, and much more rare, counterclockwise.
Right.
Because it's an extension of the entire world.
Yeah, that's what I've heard and what I've noticed. But the reason I stopped on whether it was peaks or points is because on the points, let's call it this way, right next to my temples, I've gained on that. I've actually not lost. I've gained on that side. So there's that, right? And I still haven't gone to the consultation with Sean Benham. I'm still waiting for other things. And basically, my last piece of the game would be to actually get on Lonitrin as opposed to a generic, and then give it enough time to see that. But I am kind of thinking more about going for the consultation and see. Considering more the surgical option at this point, because one, I'm 50. 2, I've been on the medication for a significant amount of time. 3, I kind of stabilized some of the things.
I don't think Sean would operate on you unless he thought you were a good candidate.
Definitely not.
So if you decide to go to Sean, I think that you're, and if he does operate, that means that you're at a point in your life in your hair loss where it's going to make sense. So,
well, I want to hear that too, regardless.
Yeah, you have to hear. Of course. Now, I want to point something out to Joe. I love doing this. This is actually a point of confusion, even among people in the hair restoration field, because the terms are often used interchangeably, even though they refer to different anatomical areas. Temporal angles. These are the corners of the frontal hairline. They mark the transition between the straight frontal hairline and the side of the hairline. Like I was saying. temporal points. These are located further down and to the sides of the head in front of the ears.
Mm-hmm.
That's it. There's no other definition in reality than that.
Who was saying temporal peaks? That's the word. There was no. It wasn't temporal angles versus temporal points. It was temporal peaks.
Okay.
Who was saying that?
Okay. I'm going to give you that. Let's see. Wait. Okay.
It was me originally. That's why I kind of stopped. So I'm like, I think I'm getting it wrong.
I don't remember talking about temporal angles. Of course, I am getting older. Maybe we were. I don't know.
Temporal peaks. It's a slight forward projection of the hair just behind the temporal angle. So this is the point. This is the peak. This is the angle. Deal with it.
No.
I win again.
This is the point right here.
That's the point.
The temporal point.
Correct.
Peak being the highest point is here. That's the temporal peak, and the temporal angle. They overlap. It's the same thing.
I'm gonna give Joe what he needs, and let him think that there's no separation between the temporal peak and the temporal angle.
You can actually check out the definitions at hairtransplantmentor.com/glossary.
Listen, brother, it's always good hearing from you. I'm glad that you're on your way to smoking less. I don't say this to judge you. Like I said, I love drinking and smoking. I don't do it, but mentally, I love it. But I know that I can't do it.
Good. Feels good. Yeah. Feels good. One last thing before I let you guys go. I did a little bit of an experiment, partly inspired by Mr. Rolandas, actually. He has a video when, a few years back, I think, where he does the, what is that thing that you use, Spencer?
Dermatch?
Yeah, Dermatch. There you go. So he has one video where he's like, let's see if that works and it's waterproof. And he puts it on and he actually dunks himself into the pool. And it's like, lo and behold, it does hold. I did something a little bit more silly than that. I was in Palm Springs with some of the guys. And, you know, we were all about the same age with all kinds of ailments. And so I'm like, well, I'm in Palm Springs. It's hot. It's sweaty. It's all this stuff. I'm like, I have a hairspray, and I'm like you. It's a sculpture, you know. I do layers. I do the actual styling, put a little bit of hairspray, drop the topic, put a little bit of hairspray, you know, style it a little bit more.
It's like a hair lasagna.
Yeah, it's like three or four layers of hairspray, to be honest with you. But the good thing is that when I do it, I have to tell people that I have topic, otherwise they don't know any better.
Yeah.
Right? I decided that I was like, you know what? I'm with the guys. They know what's up and everything. I'm like, I'm just going to do the experiment and just go into the pool and see what happens.
Yeah. That's not going to work out.
No,
actually, no.
Let us know. Let us know. Call us back.
No. I did it. Quite the opposite. It helped.
Oh, you did it. Okay. Yeah.
It helped. Yeah, no, it helped. I thought it was gonna it was gonna stain the pool and you know it was gonna be dripping down the back of my neck. It did not. It helped.
I would love. I got to ask your friends about that. I'm sure that it held on, but there had to be like a slight little tint around you as you were swimming.
That is possible, and I didn't check for that. But next time I'm out, I'm willing.
Like it looked kind of like a partial oil slick or something.
You know, I passed my hand through my head slightly, obviously.
Yeah.
You know, to see if there was any residue or anything like that, and no, it helped. I don't know if it has to do with the fact that I put
the hairspray. This hairspray definitely helps, and yeah, I mean, I'm just kind of busting your balls. I could see it holding pretty well.
Mm-hmm.
I mean, you probably lost some of it microscopically, but it's probably not going to leave a stain in the pool.
Yeah, and it wasn't if I did lose whatever I did, because I did tell one of the guys, I said, hey, this is what I'm doing. I'm going to show you, and then you tell me how does it look. And sure enough, I went underwater. Actually, not just didn't just wet my head and that's it. No, I actually swam underwater, a couple of times, and then I'm like, hey, how does it look? And he's like, I don't see a difference. I'm like, okay, all right. So that makes me a little bit more confident wearing that.
Yeah, and then he went back to the bar with his friends, and he's like, "Did you see that fucking guy's head?" I couldn't. I didn't want to break his heart. I couldn't say anything. But holy shit! All right, brother. Listen, it's good. It's good hearing from you. Have a great weekend. I think we're going to call it a night.
Absolutely, and I enjoyed talking to you guys after so long.
Yeah, it's good hearing from you.
So
it's great hearing from you, brother.
Wishing you the best.
Right.
Still, and I think that the only thing that is going to make this better is once they combine AI with CRISPR. I don't have anything to.
Well, they already are.
Well, who knows? Listen, you're young enough where you could. And hopefully that I'm still around. We may actually really be able to benefit from this. This shit is growing exponentially in a way that no one could really. I mean, it's difficult to project exactly what's going to happen. No one has a crystal ball, but I don't think anyone really expected this type of exponential growth from AI. Right. They knew that would grow,
right,
and they knew that they were onto something that was going to change the world. But it's fucking crazy. Just your language model, whatever they're called. What are they called, Joe? Language models?
Large language models.
Yeah. I mean, just to see how they have evolved exponentially just in the last 2 years, it's fucking nuts. It's scary, man.
Yeah. Well, that interview or that that session that you had, Joe, with one of the guys that went back to like the what was it, the macaque experiment or that
HM115. Yeah.
Yeah. That was very interesting.
Yeah, it was. It was an interesting piece of information. And like before that interview, I had done very little research. Like I did a power dive on it maybe an hour before we went on air because like the whole thing got set up pretty quick. They contacted me and said, yeah, we'd like to do this. Like, okay, fine, great, whatever. I didn't even think they were legit at first. I had to look them up and I had to ask Amin at Hair Loss Cure 2020 if they're legit. And he's like, oh yeah, they're the real deal. So I moved forward with it, did a deep dive an hour beforehand, and then did a deep dive after the interview and discovered or learned more about what he was talking about, especially with the he was referring to the stem cells in the bulge of the hair follicle. And I was like, something I wasn't sure what he was talking about. So I read it and it's like, oh, this is what this is what he means. And I figured out the clarification. And it's like, okay, now it makes sense to me. And there's I see the potential. Like the whole idea of a progesterone, is that what it's called? Receptor inhibitor. I've never heard of that even being a part of the hair loss equation. Or I have, but like, in Reddit conversations. But apparently there's something to it, and we'll see. I mean, more than one way to skin a cat, apparently, and we'll see how this works out, and we'll find out pretty soon.
I'm just hoping that it advances enough where I can have an AI nurse's aide, so I don't have to fucking depend on anybody to wipe my ass when I'm old. That's how I feel about it. Yeah. And I'll get a couple of them. I'll get one with like a Jamaican accent, a Filipino chick. I'll get one who's a hooker. It'll be great. I mean, that's my hope as an old person.
Well, if you're going to do it with AI, why not do a perfect combination of all of those?
Oh, so you're saying save money and get one? I'd rather have like a little bit of variety as far as the looks are concerned.
Right, but you know, with AI is going.
I don't want to have the same robot with the same face all of a sudden going from a Jamaican accent to a Filipino accent. That's weird.
Well, it's going to morph. Come on, let's think to the future. It's going to morph. It's going to change color. It's going to grow a booty, but you only need one.
Well, I think that is a very high order that's a high bar, brother. All right, listen, man, we're going to go.
Okay.
Thank you so much for the call. It was great hearing from you.
Likewise.
All right,
Likewise.
take care.
Take care,
Bye-bye.
Gypsy.
All right.
Bye.
I don't know, guys. You want to? Joe's got to go.
It's 5:30, dude.
Yeah.
Yeah.
All right, we're not going to take your call,
Gotta go.
caller, who's holding on. Sorry, we got to go. I'm staying here. I'm waiting for food. Let's see. When is it coming? I don't know if I'll have time to go on to Instagram to take your call. But I mean, if I take the time to go on Instagram to take your call, you can't hang up. So I'm going to ask you right now. Hold on. Caller, if I go on Instagram to take your call, it's going to take me about 7 or 8 minutes. Are you going to hold on or are you going to hang up?
Sounds like you
Caller?
did already.
All right. Good. I don't have to work. See ya. Fuckers. All right. Listen, guys, until next time. And Joe, I'm sorry. I certainly didn't mean to embarrass you with my temporal peak and angle knowledge. So I apologize in advance.
Not at all. Good try.
All right, guys, listen, until next time, be strong, God bless, and thank you so much for listening. And have a good night.
Thank you very much. I'm sorry for any inconvenience you may have been put to prior to the program, and I'm glad you enjoyed it. And if you could now leave